Um, my name is Judy Mark, and I'm the president of Disability Voices United. We're a statewide organization in California, although we work on national issues as well. We are a our mission is that we advocate for choice and control over our lives, meaningful outcomes that matter to us, and systems that are equitable and accountable to us. And we are exclusively directed by and for people with disabilities and their families. If you would like more information about Disability Voices United and you've never worked with us before, then you please go to our website at disabilityvoicesunited.org. Once again, for those of you who are joining us, we are offering interpretation in both Spanish and Korean, and we are also offering closed captioning. All right, so let us get started. Why are we having this event? Well, for those of you who are joining us, you are very well aware that the outcome of the recent presidential and congressional elections foreshadow potentially dark days ahead for people with disabilities. We are concerned about threats to our civil rights and to funding for our education and healthcare and community services through Medicaid. And those cuts can put people with disabilities at great risk. Today, we are joined by some state and national experts who are going to break down those threats and help us think about how we can unite to fight back. So welcome again to those of you who joined us, and we're going to get started with the program. So first, as always, Disability Voices United begins with hearing from the people most impacted, and those are people with disabilities. And so first, I would like to introduce you to Diana Ugalde Lara. Diana is a self-advocate living in Southern California. Welcome, Diana.
Hi. Greetings to everyone. Thanks to Disability Voices United for inviting me and giving me this opportunity to share my story. Throughout my life, I have been able to live an independent life. I attained accommodations needed for my cerebral palsy. Having a disability has not been an obstacle for me. Although I am a nonverbal individual, I have given motivational speeches and communicated my thoughts without any problem. I could not walk or use my hands, but this has not stopped me from going out and being independent. I have served on many boards and committees in the disability community. I give back whenever I can. All my life, my physical condition always misled people. Many think I have an intellectual disability. I had to prove my abilities to teachers every year to give me the right level of education. I was segregated in a special education school for many years in Mexico. Once here, at the age of 15, I did not know any English. Therefore, my school representatives thought I had an intellectual disability because I could not understand them. They placed me in a special ed classroom. Eventually, I learned English and advocated for myself to be mainstreamed in a regular education in 11th grade. I graduated from high school. After, I earned a college degree. My great efforts not to be segregated made me able to get a power wheelchair, as well as a communication device. This equipment enables me to be independent and interact with the community. I now live in my own apartment and have support for only 12 hours each day. I love going out often. Many people in the community know me. Unfortunately, there have been many other things that have made my life much more challenging, particularly around my immigration status. When I was just 2 months old, I was diagnosed with cerebral palsy. My mother immigrated to the United States and eventually got her green card. She basically abandoned me because of my disability, so I was raised by my grandmother. When I was 15, my grandmother was too weak and sick. She could no longer care for me, so I immigrated here and moved in with my mother, brother, and sister, who were born in the U.S. My mother did not want to include me when she and her husband adjusted their immigration status more than 40 years ago. She has always seen me more as a burden that bothers her. After I got to the US, I asked her to file a petition for me, but she refused again to submit the sponsorship documentation for my legal residence. For that reason, I had to wait for my brother to turn 21, so he could petition for me to immigrate. After 23 years of waiting in line, I finally received my work permit last August. I am just a few months away from interviewing for my green card. However, my legal residency is at risk because of the dangers posed by President Trump. I fear that my green card may be denied because my physical disability. It might be seen as a public charge. While I have a disability, I am fully capable of holding a job. I have a lot of skills. My worry goes a step further. I do not know what I will do if my future holds a deportation. There is no one able to care for me in Mexico. I have not lived there for many years. I should have been given legal residency when I was a baby, and should be a U.S. citizen now. Today, I am on the verge of having my dream come true. I am very stressed about what might lie ahead. Unfortunately, Trump is promising to target immigrants and slow the process of granting green cards. This will affect me by waiting longer to get my status adjusted. In addition, if there are cuts to Medicaid, it might affect my Medi-Cal benefits, which cover my equipment expenses on top of my medical necessities. Without my electric wheelchair, I feel like an ant. When I sit in my manual wheelchair, I am not independent. Others need to push me around. So, people treat me differently. They do not talk to me, they talk to my staff. Nevertheless, I am trying to be positive. I continue to wait for my immigration interview to finally get my green card. I am looking for a good job as well, in case any of you know of one. For me, life has been harder than it should be. Getting my green card is another step in my life. It won't be easy, but I need to succeed, because the United States is my home. I love this country, as well as all of the opportunities it has given me. I look forward to working with all of you to ensure that people with disabilities, especially immigrants, like me, are able to achieve the American dream. Thank you for your attention.
Thank you so much, Deanna. You are the reason why we are here. People like you who we are representing and will advocate for in the long term. We're going to move on now to Alison Barkoff. Alison Barkoff is coming to us from Washington, D.C. She is the former Assistant Secretary for Aging at the U.S. Department of Health and Human Services and was the Director of the Administration on Community Living under President Biden. She is currently an Associate Professor and the Director of the Hirsch Health Law and Policy Program at George Washington University. Thank you so much for joining us, Alison.
Great. Thank you so much, Judy, for having me, and to Disability Voices United. And thank you, Deanna, for kicking us off and really helping ground us in what's at stake. In addition to all the things that Judy shared, I'm a longtime disability rights advocate and disability policy advocate, and myself am a sibling. And have been involved in disability policy for many decades. Judy asked me to briefly talk about, from a national perspective, some of the changes that we might be seeing in programs that support people with disabilities, and particularly Medicaid. So I'm going to first talk about what we might see from Congress related to Medicaid, the new Congress that starts in January. I want to talk then about the federal budget and programs that support disabled people. And then finally, I'll end by touching on some regulations that have recently come out that are very important to people with disabilities and the kinds of threats that might be there. We are really starting to hear about potential cuts or restructuring of Medicaid in the upcoming Congress. And Medicaid is the national program in California. It's called Medi-Cal, that is critical to people with disabilities. It is the primary funder of home and community-based services, but it also provides a wide variety of healthcare and behavioral health services to people with disabilities and also people with low incomes, including many direct care workers rely on Medicaid. The disability community has been advocating for more funding for Medicaid, and particularly Medicaid home and community-based services, to address waiting lists for services, to increase provider rates, and to increase compensation for direct care workers. So that's where we are today. We know that a top priority for the incoming administration and the new Congress is to renew the Trump tax cuts that are going to expire in 2025. And those are going to be extremely expensive. And at the same time, the new administration and Congress is also talking about the need to reduce the federal deficit. So they are looking for programs and really talking about making significant cuts to programs like Medicaid to reduce federal spending and to pay for the cost of tax cuts. I want to just talk about the kinds of things we are hearing in Congress. The bottom line that I just want to start with is we don't know exactly the proposals yet, but all of them that I'm going to touch on are ones that could significantly impact access to services, eligibility for Medicaid, and have a significant impact on people with disabilities. And when you're making these kind of tax rules, there is a special process called reconciliation that only requires 50 votes in the Senate. So many other rules and most of the things we do, we're thinking about how to get to 60 senators to support it or how to pick people off so they can oppose it. We are in a special world when they use something called reconciliation, and you'll hear this a lot in the news. And I want to make sure people understand that this is a special budget proposal that they can use for tax cuts. We are going to be hearing about that. Some of the proposals that I'm going to briefly mention are similar to ones that you might have heard from 2017, and some are new ones. But again, I just want to emphasize all of them have significant impacts. One is the possibility of capping the way the federal government matches state funding for federal programs. And it's something called either a block grant or per capita cap, that instead of really matching the actual use of services, a set amount goes to states. And what we saw from all of the data when this was proposed earlier is this would lead to very, very significant cuts in states' Medicaid programs. And I will want to remind everyone that home and community-based services are optional. So the first things that get cut are things that are optional and really put at risk the very, very important programs that all of you have been advocating for. The second thing that you might be hearing about is some significant changes to the structure of the Medicaid expansion that was part of the Affordable Care Act. And I just want to emphasize that many people with disabilities are part of the Medicaid expansion population. That includes people with serious mental illness, some people with autism who might not otherwise meet the disability pathways into Medicaid. And as I mentioned, many direct care workers are part of the Medicaid expansion. And there are a number of proposals to cut funding, to cut eligibility. And again, if there is cuts to one part of the Medicaid program, it's going to have an impact on all parts of the program, and there won't be able to be the kinds of investments that we need. A third proposal that I just want to kind of mention, a type of proposal, and it's going to be important for us to educate people how these are cuts too, is creating barriers to getting on Medicaid or staying on Medicaid. That can include everything from work reporting requirements, which you may hear, oh, people with disabilities or caregivers are excluded. But what we have seen from the handful of states that have put in place these type of requirements is that many people end up losing coverage because of the paperwork burden and the bureaucracy of having to do this reporting. And there are also proposals to cut eligibility or make you have to prove your eligibility more often. The bottom line of every one of these proposals is that it will impact the disability community. It will take money away from the Medicaid program. And the most important thing for the community to be doing right now is making sure members of Congress are educated on the importance of Medicaid to people with disabilities, and really talking about how any proposals to cut or restructure or add burdens would hurt people with disabilities. So that's the first thing that we really need to be looking for in Congress. The second thing that you will probably hear a lot about from this administration and the new Congress is a desire to hugely cut federal funding. We know that they are working as we speak on passing a budget for the federal government that may take us maybe until March. So this is probably a fight that will happen in the spring. But as someone who until recently ran a federal agency that has all of the disability and aging programs, the things that they are talking about cutting are literally the programs that support people with disabilities. Things like our protection and advocacy system, centers for independent living, DD councils, long-term care ombudsmen, adult protective services, and also many programs that disabled people need to live in the community, affordable, accessible housing, nutrition supports like SNAP. So we really, at this point, need to start, again, educating members of Congress about the importance of disability, housing, nutrition, and other programs, and how they help people with disabilities stay in their own homes and stay in their own communities instead of being placed in more expensive institutional settings. And then finally, I will end with regulations. So really, because of all of you on the on this webinar here, over the last several years, there have been really, really important regulations that came out from the federal government to strengthen the Medicaid program, to streamline access into Medicaid, and to protect the civil rights of people with disabilities. That includes things like the Medicaid access rule that had provisions about expanding access to Medicaid, home and community-based services, strengthening the direct care workforce, and improving the quality of services. And on the civil rights side, Section 504 of the Rehabilitation Act that was really critical in improving people's access to healthcare, accessibility of medical equipment and kiosks and websites, and increasing access to community-based services, as well as Section 1557 of the Affordable Care Act that not only protects against disability discrimination, but has many requirements around language access, for example, that I know are important to this community. We are seeing these regulations challenged in many ways, from lawsuits in court that we are concerned the Biden administration is defending these rules, but we don't know if the Trump administration will continue those. We have seen some of these regulations be part of conversations to be pay-fors or to offset the costs of the tax bill, and that could be one way that Congress repeals them, or we may see that federal agencies might try to open these rules and change them. And there will be an important role for all of us in terms of public comment on those rules. I know Zoe is going to talk about those a little more, particularly Section 504 in a moment, but I just want to end by saying it is a really important time to stay engaged, to be vigilant. Over the next 2 to 3 months, we really need to be talking about the programs that are important to us, that educating our members of Congress about how they are important to our lives, and really laying out a foundation of educating people. And then when we hear about specific proposals, there are incredible national organizations that will be able to work with state and local advocates. So you can take this national information about what's happening and really, really target it to your communities and to your representatives. So with that, I'll turn it back to Judy.
Thank you, Alison. That was so helpful to sort of center us on what we're expecting, particularly around our healthcare. And to take it even further, I am so honored right now to introduce our next speaker. Congressman Raul Ruiz from California and is such a champion for our community here in our state, but as well as nationwide. Dr. Ruiz represents the Coachella Valley, and I know there are a bunch of folks here at our event today who are constituents of yours, so we are so thrilled to have you. Let me just tell you a little bit about Congressman Ruiz. He represents areas like Indio and Hemet, and he also grew up in Coachella Valley, so he's really from the community. He lived in Indio, he lived in the Coachella, and both of his parents were farm workers. But he kind of left the community for a while because he went to Harvard, where, well, first of all, he went to UCLA, which is my alma mater, so I just want to give a shout out to that. And then he went to Harvard, where he got 3 degrees. He went to medical school there. He got a master's in public policy from the Kennedy School, and then a master's of public health. That is pretty amazing in my view. He then returned home, where he began working as an emergency room doctor, and he mentored young doctors in Coachella Valley. He was elected to Congress in 2012. And we are so deeply appreciative of you joining us today. Welcome, Dr. Ruiz.
Thank you so much, Judy, and thank you for that introduction. And hello to everybody who's on this call, and a special hello to all the constituents that I represent here in Congress and around the world and in our district. There's not a single day that I don't think about you and how I can better serve you. I'm Congressman Dr. Raul Ruiz. I'm an emergency medicine physician, and I represent California's 25th Congressional District. It's basically the southeast corner of California. It borders Arizona, Mexico, and has a little bit of the border with Nevada. It has eastern Riverside County and all of the Imperial County and a bunch of land in the easternmost part of San Bernardino County in California. And I want to thank the Disability Voices United for hosting this important webinar and for advocating on behalf of marginalized communities, ensuring that their voices are heard. So as we approach the start of a new administration, many of us are feeling a sense of anxiety and uncertainty, especially among those who are often marginalized or vulnerable. It's crucial that we continue to hold events like this, where we can discuss the strategies needed to advocate for those who will be impacted the most by changes in the federal policies and funding. People with disabilities need strong federal laws, consistency, policies, and programs that prioritize their needs and aspirations. And as an emergency medicine physician, I understand how essential it is that the people I care for and the people that I represent, especially those in vulnerable populations, have access to affordable, quality healthcare. That's why I'm deeply concerned about Trump's Project 2025, which directly targets healthcare for tens of millions of Americans. So a little bit about this project. Project 2025 is Trump's plan that was created by people that used to serve in Trump's administration that came together to determine what will the Trump policy agenda be. During the campaign, Trump denied it. He said he didn't know anything about it. He says it's not his plan because it's a pretty difficult plan to swallow. And sure enough, those people that wrote the plan, he's now appointing them back into those positions of influence where they will be able to implement Trump's 2025 plan. And it has things like it will repeal the Affordable Care Act, strip affordable coverage for more than 21 million Americans. The proposal also includes adding lifetime caps on Medicaid, which would jeopardize healthcare for another 18 million people. So Medicaid, which is Medi-Cal in California, provides critical services such as wheelchairs, ventilators, personal care attendants, skilled nursing care, medical transportation, and supported employment. And so under the Project 2025, millions of disabled people and others would be pushed off Medicaid through asset tests, eligibility reviews, cost sharings, and work requirements. These changes could force disabled people out of their homes and into hospitals and nursing homes, which could have devastating consequences for their health and well-being. So people with disabilities need Medicaid to live independent, dignified lives in the community. It definitely helps. So the only beneficiaries of Trump's Project 2025 would be the billionaires and big corporations who would profit even more by squeezing the system at the expense of vulnerable individuals. All those efficiency reforms that Elon Musk is tasked to do. Well, he's going to look to not only cut the payroll, but those individuals he cuts are usually individuals and departments that he wants to eliminate, because they consider that wasteful spending, and that is to justify then the millions and billions of tax breaks they want to give to millionaires and billionaires. So we can't let that happen. And we must all work together to protect and strengthen the vital systems that support our most vulnerable citizens. So here is the good news. We have the power to stop it. Any legislative changes, including those proposed in Project 2025, must pass both the House and the Senate. The Republican current majority margin is very, very slim. There wasn't a massive red wave mandate that Trump claims, because there is a very slim majority margin in the House and in the Senate. So we have a fighting chance to block harmful legislation and cuts to funding. So by standing firm and working together, seeking bipartisanship where we can ensure that the future is built to protect and strengthen these critical programs. The progress we've made so far is a testament to our shared values of compassion, fairness, and respect for all individuals, regardless of their backgrounds. These values will continue to guide us as we navigate the challenges the future may bring. So while the road ahead may not be easy, I have hope that through ongoing dialogue, commitment to justice, and a spirit of collaboration, we will emerge stronger, able to protect all Americans, especially those who are most in need. So as a physician who has dedicated my life to serving people, I will stand firm against any efforts to undermine the health and well-being of our most vulnerable populations. So I will continue to fight for the future that we all deserve, a future with dignity. Thank you.
Thank you so much, Congressman Ruiz. We deeply appreciate your support of our community and championing on our causes. And I just want to make a comment. If you guys could highlight the Congressman again, please, that we stand strong to not be pitted as people with disabilities against other poor people, because we see that's the future, that there will be efforts to say that people with disabilities are the deserving ones for Medicaid, and that other poor people are not the deserving ones. And we know that many of the staff who support us are those people who are also getting Medi-Cal. And we know that many of our family members are also getting Medicaid services. And so we will stand strong. We will unite with other groups to make sure that our services and our rights are protected. And we thank you so much for all that you do for us.
Well, thank you for all that you do for all of the people that you represent and you serve. I really do appreciate the work that you do.
Thank you. Thank you so much.
Bye-bye.
Bye-bye. All right, so we now heard from the federal level. We had a person in the Biden administration who now works for GW, and we just heard from a member of Congress. And now we're going to move to the state level, where we are going to hear from Kim McCoy-Wade. Kim is, many of you know Kim. She has participated wonderfully in many of our activities. Kim is currently serves as the Senior Advisor on Aging, Disability, and Alzheimer's for the Office of California Gavin Newsom. And Kim is a longtime champion for the rights of people with disabilities, and we are so honored to have you here again. Thanks for coming, Kim.
Thank you so much for bringing the community together at a time that probably I saw someone in the chat say, I know for myself, and I see in the chat, lots of big feelings, lots of big thoughts. So the best thing to do is to come together and figure it out. I am delighted and honored, frankly, to be here on behalf of Governor Newsom, who you all know, and to be one of the only, if not the only, governor's advisors on disability. So it is very important that you all talk to me and communicate with me so I can make sure he is hearing from you your priorities, your needs, your strategy. And I want to start with that. The disability community has a long, strong, proud tradition of advocacy and success and creativity and innovation in doing that. California has many, many stories. National has many, many stories. I don't need to tell this group, but I'm thinking back to things like, and to someone else's comments point, against Republicans and Democrats, right? Disability has always been an issue that transcends party issues, but the 504 sit-in, the Capitol crawl for the ADA, the 504 sit-in for civil rights, the work that I've been privileged to do with many of you to get CalFresh access, to get a master plan for aging that centers people with disability, aging and acquiring a disability. And of course, our work on COVID, which was some of the toughest work in my career to date. And so we know we can do hard things, and we know we have to stand together and take care of each other. Here's what the governor is challenging us all to do, and what I want to challenge all of us together. You know, nothing has changed in California. Our values remain strong. The governor's priorities remain strong. What's going to have to be a little different is how we get the job done and the defense and protection we may have to do, not to get ahead of where we are, but reading Project 2025 and taking this administration at their word. It's wise to be prepared. It's wise to be, anybody who knows me knows I'm a planner, and as is the governor, sees far ahead. So California's values of inclusion, California's values of community living, California's views of civil rights still stay strong. We are increasingly getting organized and focused on three pillars that you're going to hear about today already. One is, frankly, fundamental safety and civil rights. I just have to start with that. I know many of us are feeling fear, whether it's from loss of supports that are critical, deportation, hate crimes and hate violence, let's face it, both for disability and for intersectional. We know our autistic community is disproportionately LGBTQ, so there's a lot going on here that can make us fearful. And I'm just going to spend a second on fear, and then we're going to move to strength, but we just have to kind of acknowledge we're all in this in our ways. I'm also very worried about the disinformation about autism and the disinformation about vaccines. And when vaccines are so important, particularly, but not only in the disability community, we need to make sure that how do we get our information out in this changed world? I'm worried about disaster safety. You've heard the governor talk about, well, I don't know about you all. We have an earthquake this morning here. All my children are evacuated from schools. They're fine. That's why I was a little late, Judy. But everybody's fine. But, disaster response and preparation is part of California life. And so that is a very important issue for people with disabilities. Thank goodness for Vance Taylor in California helping us all get organized. But that could be weakened. And I'm very worried about what I continue to believe is the last bulwark against poverty for most Americans is the food stamp SNAP CalFresh program, which is so critical for people with disabilities. So there's a lot to be worried about. That said, way back when this is not his first go round with President Trump. We have on the safety front, our wonderful Attorney General Bonta is ready to file the lawsuits, the special session this week to do that, made it clear that we're ready. And beyond that, we continue our work on California versus hate. We continue our work with the California Civil Rights Department, the largest civil rights department in the country at the state level. And frankly, it might be in the nation very soon. But we have a robust civil rights department by Kevin Kish, lots of work on disability and aging and all other intersectional. So want to honor and acknowledge the fear we're all feeling about our safety from many different places. And I also want to lift up that California is a bedrock value for us here, and not just words, but we walk the talk as well in our investments. A couple other areas. It's weird to say area. It's a pillar, as I said, of life. Health. Alison talked about it quite eloquently, but California Health for All is one of our governor's primary passions. We have 15 million people relying on Medi-Cal for their health care. And not only have we expanded all people with disabilities, regardless of immigration, no working disability premium, no asset test, we've also done that transformation of healthcare. So home and community services, Medi-Cal at home, the mental health transformation that I know is challenging in this community and continues to be a conversation and work. Repro care, critical for people with disabilities. Gender care, affordable medications. We're making our own meds now. So we're ready for the healthcare fight, and we need you to stand with us and stand with all the community, and we need to stand with you. It's a two-way street. The third one I just want to say that I've been privileged to work on more and more in this role is the opportunity, the cradle to career. That education needs to be invested and transformed, specialized education, change. This year, so much is happening. IEPs now do job planning earlier. The diplomas are full diplomas this coming up. The inclusive colleges. So we're going to be concerned if there's an attack on the Department of Education. Voc Ed comes from there. Department of Rehabilitation money comes from there. So but again, this governor is a champion for education. Many governors are. You will see us fight on that for sure. I could go on, but I will not. I just want to say this is what's going to be challenging for all of us, is to kind of keep both our tracking all of this, thanks to wonderful organizations like DVU and many here, but also take care of ourselves and figure out where we can be plug in and where we need to rely on the community. I'm a little worried about, Judy, you mentioned divide and conquer. Social Security, you could see some attempts to separate out disabled people from retirees in a way that is not acceptable. I'm worried about census data. That may sound in the weeds, but many people in this community worked very hard on that issue the last couple of years. So I won't, again, let's not go out to what we worry about. I do just want to finish by reminding us, we still have our vision of what we need to do. We still need basic income, SSI, SSP, to be better, to be a livable income, the asset test to be dropped nationally. And we should still keep making our vision of what we want. One of the many sad things, but also possible bright spot, was we finally had a presidential candidate talking about Medicare at home. The absolute eye on the prize, I think, for most of us. And so to be able to keep Medicare at home as a drumbeat, even as they're coming at us for Medi-Cal and Medicare, and say, everybody, most people don't know they don't get Medicare at home, disabled folks know, but that would be life-changing for disabled workers, communities, families, if Medicare provided home care. So I hope we can take that spark and continue to carry it forward, and continue to, as things come up, they'll come up. Let's not get worried too much. Let's not look at the lessons from the past. We have to come together now, see what we've got now, be different. Podcasts, protests. I missed disabled Twitter. I'm hoping they're coming to Blue Sky. We've got to figure out how to stay connected and stay active, and continue to be what California's always been, a state by the people, for the people, and by that we mean all people. So I'll stop, but thank you so much, Judy, for this forum, and I hope we do continue to, well, we will. I don't even have to hope. We will. Thank you.
Thank you so much, Kim. And everybody, Kim is going to stay on the webinar and will be available to answer questions if any of you have it after all the presentation. So thank you so much, Kim. We deeply appreciate your longstanding support for the disability community. Next, so we've talked to a member of Congress. That's at the federal level. We had the state level talking to Kim in the governor's office, and now we're going to go to the local level, and we're going to talk to a wonderful person that I love dearly, Nick Melvoin. Nick is an elected board member of the Los Angeles Unified School District Board. He is a former public school teacher who saw firsthand how special education doesn't always help the students it is supposed to. He was elected to the school board in 2017 and represents nearly 50,000 students across 150 schools in Los Angeles. And thank you so much for joining us, Nick.
Thanks, Judy, for that kind introduction. It's so nice to see you as always, even under these circumstances. But you and the folks who have gathered here today are one of the things that gives me hope in these times. So thank you. And it was great to hear Kim's presentation as well, because I think you'll hear me repeat a lot of what's been said, both the concerns, but also the fact that California and LA Unified, its largest district in the state, are on the front lines of that protection. So I'll start with the fact that like the governor, this is also not our first rodeo at the school board. My first couple of years on the board were the first Trump term. And so actually just last week or 2 weeks ago, I guess prior to Thanksgiving, we took out some old resolutions protecting kids with disabilities, protecting LGBTQ kids, protecting undocumented kids and faculty, and brush them up and pass them as a district. And so, are already preparing the way the governor is in Sacramento to do this locally as well. So we'll just talk briefly about some of the concerns I have, but where there are some bright spots in what we're doing, including those resolutions. But obviously, as you heard Kim talk about, cuts to education funding would be detrimental. LA Unified, second largest district in the country, but a district of high need, 86% of kids living in poverty. Probably, although, we don't have the hard data for obvious reasons, but probably the largest number of non-citizen students and families in the entire country. 14% of our students are students with disabilities. And so the federal funding that we get for students with disabilities for students in poverty would be critical. Less money means, less support for those critical services. We also know, as Kim talked about, that any rollback of the civil rights for students, whether that's our students with disabilities or our students who identify as LGBTQ+, our trans students, would be horrific. And so, one of the things that does, besides getting some of the things that the state's doing and that LA Unified is doing, I think that, not that I want to call the president-elect's bluff, but I think some of this is, as we saw in the first term, campaign rhetoric, and others is what they're going to do. The Republicans have been talking about cutting the Department of Education pretty much since it came into existence in the 70s. And yet the reason they don't isn't because they have a lot of love for it, but they realize that there's this federal role of distributing these funds. And there are, let's not forget, kids with disabilities and poor kids in red states. And what we saw under the first Trump administration is when there were these discussions in cutting those funding, those members of Congress who maybe aren't aligned with us on a lot have said, no, I'm not going to, under my watch, lose funding for our key constituencies. And so then when you actually think about who's going to distribute billions of dollars in funds, if you're not the Department of Education, it gets more complicated. So, I do fear things around the rollback of protections for vulnerable students when it comes to civil rights. I think there'll be some stuff at the higher ed level when it comes to protection, rolling back some of the work the prior administration has tried to do around campus sexual assault and violence. But when it comes to actually, dollars in terms of Title I dollars and dollars under IDEA, I'm less concerned because there is a coalition that's bipartisan that's fighting this. I'll also think, and I think Kim alluded to this too, but as we all know, under Democrat and Republicans alike, we have been underfunding IDEA in this country for decades. And I bring a resolution every year that the board passes to advocate for full funding. And so I think this is not, we might want to point fingers at one administration or one political figure, but I think we understand that this is, no one has acted on this and fully funding. And so the district, for example, LA Unified, we have an encroachment of about $1 billion out of our general fund to support our students with disabilities, and we should be spending more, but we need to advocate around that. Just a few more things, like as Kim said, we are grateful for the governor's leadership in California. We're grateful for State Superintendent Tony Thurmond, who's working with the legislature on a backup plan, around funding that could potentially backfill any federal cuts. We're grateful to Attorney General Bonta, who's preparing possible litigation to stop these cuts. And again, I think there will be some bipartisan coalitions of attorneys general who are doing the same because of how this is affecting students. And then locally, we have a board of education and a superintendent who aren't aligned on everything, but one thing where we are unanimous is in these protections for our vulnerable students. And so I was really proud that amidst a lot of political turmoil locally and nationally, that the board passed unanimously these resolutions I was mentioning a few minutes ago, protecting our students, and we will continue to do so. So that's whether becoming a sanctuary district to prevent or protect our students who are undocumented and non-citizens. We'll also do the same around our students with special needs. And I'll say too, and Judy knows this well, you know, regardless of what's happening in Washington, there's a lot of work we still need to do in LA to better support our kids with disabilities, whether that's around their support or communicating with families, or moving from a district of compliance to a district of creativity and a district of just providing services to parents before you have to sue us for it. So I just want to know that. And I'm focused on that. Like, yes, we're going to block and tackle against Washington, but I also don't want to let the district off the hook for more that we can do for our vulnerable students. So appreciate it. Appreciate the opportunity to be here. And, you know, if you folks want to reach out directly to me or my office, please do with your suggestions, or if you're building coalitions, we'll sign on to letters. I spend, you know, a couple weeks in Washington every year doing lobbying on behalf of the nation's second largest school district. We also have great allies like the Council of Great City Schools, which is a consortia of the largest districts in the country. And this is one of our priorities, that council, students with disabilities and funding for special ed. So, you know, look forward to our continued conversations. And Judy, again, just appreciate the opportunity to come and talk about what we're doing at LUSD in partnership with you.
Thank you so much, Nick. We thank you for being a champion for students with disabilities. And I know that we can count on the ongoing dialogue to improve things at LUSD, but also to protect students' rights to an education. Thank you so much, Nick.
It's my pleasure.
So we are going to now move on to Zoe Brennan-Krohn. Zoe is the National Director of the Disability Rights Program at ACLU. Zoe has been a strong advocate for people with disabilities for many years. She has testified before the U.S. Congress on conservatorship issues and has been a strong partner with Disability Voices United on getting supported decision-making placed into California law. We're so happy to have you here, Zoe, and thanks for all you do for our community.
Thanks so much, Judy, and thanks so much to everyone for being here. My name is Zoe Brennan-Krohn. I use she, her pronouns, and as Judy said, I'm the director of the Disability Rights Program at the American Civil Liberties Union, and we work nationally. I live in San Francisco, so I'm local to many of you. I'm a white woman with long curly black hair and a blurred background. So within the ACLU, we focus on a wide range of issues, not just disability issues. And all of the issues we look at, including disability, we think about really at the core intersection of the topic and civil rights and civil liberties. And even that is something that is new to a lot of people, not to the people on this call, but to people in the country, to think about disability rights as a civil rights and civil liberties issue. It's not a matter of charity. It's not a matter of cures for many people, for most people. It's about the right to live in the world, to participate in society, and to do so on an integrated and equal basis as people across the country. So we do pursue litigation, we do advocacy, we work with a lot of grassroots groups to move towards this vision of a country in which people with disabilities are equal, valued, welcomed members of their community who live in their communities and are not segregated. And so disability has, you know, disability rights laws are great. I'm a lawyer. I like laws. I really like the disability rights laws. They have incredible power that has not yet been fully tapped, even that there's an idea that disability rights laws require something that's more like equity than equality. So it's not just saying, well, you can't shut the door on disabled people, but it's actually saying you might have to build a ramp to that door. And that's really unusual among civil rights laws, that you're requiring entities to do something different in order to give disabled people equal access. So I say that partly just because I like to talk about the positive things that we have, and just that we have a lot of power in the disability rights community and in this moment legally, even looking forward to a potentially really frightening changes in the next administration or the next years. So I want to talk about 3 issues that we are really watching closely to see what's going to happen with respect to people with disabilities. I fully agree with what many others have said, which is we don't know what's going to happen. And you never know what's going to happen. What people campaign on is not the same as what they do. And we simply don't know how things are going to shake out. So I think it's important to sort of approach this time with this kind of balance. Kim mentioned this as well, of being, or everyone did in various ways, of being watchful, being organized, being attuned, and also not getting too far ahead of ourselves. So the first thing I want to mention, which Alison talked about at the top, and basically everyone has referred to, is Medicaid. And there have been a lot of talks about really massive cuts to Medicaid, whether it's in the form of block granting, which means that states would only be able to get a set maximum amount of money from the federal government for Medicaid, or work requirements, which, as Alison mentioned, would technically not cover many disabled people who would not be required to work, but would functionally slash the numbers of people on Medicaid because of the requirements for reporting. And I think one of the most important things when we talk and think about the Medicaid issue is to really educate people in Congress and people we're interacting with about Medicaid as a civil rights issue. It's a form of insurance, which is a way to get health care, which is, I think, how people think of it. But Medicaid in particular is unique and incredible in the promise it offers, not fully or not fully fulfilled, but the promise of providing people care in the community and the supports and services they need in the community instead of having to be in an institution. And that's quite remarkable. And that is, I think people don't always realize that. Getting cut off Medicaid isn't saying like, well, you just can't have healthcare anymore. You might be able to, there's tons of people who are on Medicaid who work and they have private insurance through their employer and are still reliant on Medicaid to get the kinds of sometimes very expensive care, support services, medical devices that are needed to live in the community and to stay out of institutions. And that is, when we look at the history of people with disabilities in this country, the way that disabled people have faced, continue to face discrimination is through exclusion and through segregation and through being pushed aside and being forced into institutions. And so Medicaid is this incredible tool that allows many people, not enough people, but many people to avoid that, to live in their communities. And I think that that's a really big education process that we need to undertake to challenge threats to Medicaid, to really have clarity about what this means, what Medicaid does. Because I think the people who are in this world, who are on this webinar, think about this stuff all the time. We all know what HCBS is. We know about the waivers. Most people in the world, and probably most people in Congress, do not. The second thing I want to talk about a little bit of another category of things we're watching is around the Health and Human Services regulations implementing Section 504. And Section 504 of the Rehabilitation Act is is the precursor to the ADA, very similar to the ADA. And just this year, in 2024, the Department of Health and Human Services finalized new regulations that talked about how disability rights laws apply in certain healthcare settings. And there were really important pieces of that regulation. It says that medical decisions made by doctors can't be based on stereotypes or biases. And probably, I might hazard a guess that everyone on this webinar has had experiences with medical professionals where you see that they don't understand the value or the experience of a disabled person's life. And they make judgments based on stereotypes, that a person's life isn't as valuable, that a person doesn't have a good quality of life simply because of their disability, that they can't comply with medical care or prescriptions. And in some cases, people get denied organ transplants simply on the basis of stereotypes about disability. And this rule said that's disability discrimination. You can't make medical judgments based on bias or stereotype about the value or the experience of a person's life. You have to actually look at that person, their actual life experience. The rules also talked about physical accessibility of medical equipment. The numbers of people, again, probably many people on this call who themselves or have had other people, yes, it's just went in the chat. You got to my punchline ahead of me, Michelle, that many people are denied treatment like mammograms or MRIs or even basic exams because they can't physically access the machinery. Or let me put it the other way, it's that the machinery is not accessible to them. Doctors don't have accessible exam tables, devices, MRI machines, and so people are denied care. And this new rule sets in place a path through which medical providers have to get and provide medical equipment. And then the last piece I just want to flag about this rule, which is very exciting, and on preview is a little, we want to make sure it doesn't get, it stays, is that the rule talks about the rights of people with disabilities to be parents and the importance of non-discrimination in departments of children and family services, assessing whether adults with disabilities are fit to be parents. And very, very often there's just a presumption that the fact of a person having a disability means they can't parent, and Children and Family Services or Child Protective Services gets involved in cases really as a matter of course in really stunning instances of parents who have a physical disability, a sensory disability, an intellectual disability, and some nurse or someone at the hospital at birth says, I don't think this person can parent, and it sets in motion these really catastrophic consequences of separating the parents based on an assumption, based on a stereotype, or based on a doctor saying, well, I don't know how I would parent if I were blind, so I'm going to assume that this blind person can't parent, instead of curiosity. So that in this rule, it talks about the importance of non-discrimination in those decisions about the right to parent, and the importance of making accommodations or modifications in deciding whether people can parent and in helping people learn to parent better, and more safely. So this is all of those things are under this one new rule, the Health and Human Services Section 504 rules, which we're watching. We are worried about whether they will stay. This is currently in place, but it's in this category of things we're watching. We have some concerns about what's going to happen going forward. And that's also something where there's a lot of education, right? This is like a little, like, I'm kind of nerdy, but I get that the point of like HHS's new regulations is not like everyone's, top topic to discuss. But I do want, part of why I wanted to really be concrete about it is so it's kind of percolating around that if something comes up where, okay, we really need to rally around this because there's a real threat to it, that people have sort of started to think about what this is and what would be the impact if it got challenged. And I am over my allotted time, but I'm just delighted to be here, to be talking to everyone, and to hope that this is the beginning of many conversations, because there will be a lot to do, but it's just wonderful to be here with everyone. Thanks, Judy.
Thanks, Zoe. And yes, this is the first part of many conversations over the next several years. And Zoe is also staying on, so she will be able to answer questions. All right, let us move on to talk about a really critical issue that has been talked about by many speakers, and that is immigration. I'm so happy to welcome Ben Chao here from the California Immigrant Policy Center. Ben serves as their health and public benefits policy manager. He's an expert on the public charge issue, and you're going to hear about that, but he'll also talk about some general immigration issues. Thank you so much for joining us, Ben.
Hi, thank you so much, Judy, and for making space for me to talk about this. So yeah, hi everyone. Again, my name is Benyamin Chao. Pronouns are he, him, they, them, with the California Immigrant Policy Center. The California Immigrant Policy Center, or CIPC, is a statewide immigrant rights advocacy organization that advances policies that uphold and protect the humanity of our immigrant population. And so while we don't have a a direct focus on disability, we do know that a lot of the programs that we are advocating for and trying to protect do serve people with disabilities, including those in the immigrant community and their loved ones. So yeah, Judy asked me to speak, as much as I can about just what we are anticipating broadly around immigration with the Trump administration. And one thing I wanted to kind of to touch upon was that leading up to the election, CIPC engaged in a very comprehensive a scenario planning process with our partners across the state, from San Diego all the way to counties in the North Coast. And we were able to conduct 15 scenario planning conversations that were attended by over 500 people from over 250 organizations. And we saw some pretty clear themes as we held these conversations about what threats people have top of mind with the Trump administration. The first one was safety. So as folks have mentioned, on this call, safety for immigrants looks, different in a lot of ways. In particular, safety from ICE arrests, from detention or deportation, from their local law enforcement, colluding with ICE and sharing their information, or their own privacy and fears of their data being shared to harm them or their families. The other was socioeconomic security. First being an attack on public benefits programs, whether that's to reduce the funding for these programs to our state, to limit eligibility and reduce who can qualify based on their immigration status. And just due to the overall climate of fear and another issue called public charge, where people can be denied access to a green card for using benefits, drop-offs, and we're concerned about drop-offs in enrollment, otherwise known as a chilling effect. And the last thing is people shared concerns over their organizational strength. And as we weather all these different attacks and the chaos, making sure that our organizations have the resources to address these threats and meet the needs of their communities. And so to address these concerns, we have several different legislative priorities that we are working on. One is, directly related to Trump's, promise to enact the largest deportation program in history from day one, using every resource at his disposal. And we know that California has to protect its residents from these cruel and inhumane deportations. And there's a group of advocates called the Eyesight of California Coalition, which leads on this, and they're developing legislation to bar local and state agencies and departments from using these funds, from using their funds or facilities, any equipment, technology, or personnel to assist in immigration enforcement. You may be familiar with the California Values Act, or SB 54. This was passed during the last Trump presidency, which did reduce and curtail local and state law enforcement's ability to collaborate with ICE, but it didn't eliminate it entirely. And so advocates are looking for ways to strengthen, what we call a sanctuary state law, and also improve them at the local level as well. We're also, especially as we dive into our state budget process, are looking for the state to increase its investments for rapid response and legal services, especially in underserved and isolated regions and in rural areas as well. This will help us ensure our community safety across California. For example, for emergency hotlines and dispatch systems when we hear about an ICE raid in our community. And when people are facing threats of deportation through legal proceedings, making sure that they have those resources, information for Know Your Rights, and resources for community organizers and trusted messengers to host Know Your Rights trainings in their community. And fortunately, we are seeing. Really glad to see Kim McCoy-Wade from the governor's office here to talk about, the leadership that California will be taking that we're already seeing. And we're seeing there was an announcement earlier this week from the a special session held for making budget investments to invest in the One California Network, which is a network to help fund these legal services programs. So yeah, I just really want to encourage folks to be on the lookout for Know Your Rights materials to once you find them, circulate them widely so that every our entire community knows where to go as we anticipate and see all of these attacks. And lastly, my focus in particular is on access for immigrants to food assistance programs and in particular the public charge rule as well. So CIPC is a member of a national coalition. It's called the Protecting Immigrant Families Coalition. And this coalition formed during the first Trump presidency to combat the proposed for the Trump public charge rule and other attacks to public benefits. And our top of mind concern for that is how Trump may weaponize the public charge rule again to restrict, to perhaps add types of services that could make it less likely for someone's green card application to be approved. And the intended outcome there is to discourage immigrants from using their eligible benefits. So we do expect to see new rulemaking to have a Trump 2.0 public charge rule. And we will be relying on our advocates, partners there to help us push back through the public comment process, which we were able to do the last time around. We were able to stall the implementation of the rule, and afterwards, several lawsuits in several states helped delay the rule until Trump left office. And with a Republican trifecta in Congress, we are concerned about proposals to cut eligibility for immigrants. So we are relying on our federal partners there to monitor that as well. But given how close the margin is in the House, we may play a key role here in California to engage some of those more moderate Republicans to oppose any of these proposed changes. And the tough part about all of this is that we don't know exactly when these attacks will happen or what they will be. Something we've maybe even worse that we haven't thought of, but the importance here in supporting our immigrants is having a strong network and flexing those muscles when we can to rapidly respond to these threats. And so I encourage folks to please reach out to me if you're interested in being on a listserv for this information. And having information to rapidly respond to them as well. But I will pause there and hand it back to Judy.
Thank you so much, Ben. That was really, really helpful. And I think you might see in the chat some people are asking for some of those resources, and if you might want to put some links, that would be really helpful.
Sure,
Our
sure.
final speaker today is Amy Westling. Many of you who are Californians with developmental disabilities or family members know Amy. Amy is the executive director of the Association of Regional Center Agencies. And I just want to say publicly here that DVU is proud to partner with ARCA to fight back any cuts that might be coming. And we are really looking forward to working with you on this. Thanks, Amy.
Thanks so much, Judy, and thanks to the over 300 people who have joined us today to talk about kind of next steps. First and foremost, I want to echo something that Kim said a little bit earlier, which is that disability is not about party lines. We know that in California and actually at the federal level as well, that our policy has been advanced to be among the most generous in the nation. And we've done that with the support of both parties, Republicans and Democrats. In fact, Assemblymember Lannerman, who authored the Lannerman Act, was a Republican. And so I think we need to just all acknowledge that this is an issue that cuts across political lines. And at the end of the day, we all need to remain committed to our priorities. And our priorities as a regional center system include continuing to work with our communities to support people in the way they deserve to be supported, and to continue doing broader and broader outreach to diverse communities, and to work on issues of equity and really ensure that the services that we're providing are unique to each person and really do meet their needs. One of the things that makes California unique and makes us unique in the nation is that we provide these services to people regardless of whether they have Medicaid or not. And that sets us apart, and it makes it so that we don't have waiting lists to get into our system. And there's a variety of reasons that people don't have Medicaid or don't have enrollment on the Medicaid waiver that helps bring down federal dollars. But the point is, we believe that getting services to the people when they need them is critical. And so really staying focused on how do we make sure that the federal dollars keep flowing into California? That's our focus. Our system at this point relies on almost $6 billion a year of federal dollars. And so we will work with anybody at any time in any way to ensure that those dollars keep flowing and that the federal dollars continue to support the programs that we know that people are reliant on, not just those programs provided by regional centers, but as we've heard, for special education, for healthcare services, for IHSS, a variety of things that people with developmental disabilities and their families rely on to get through the day and to ensure that they have the quality life that they deserve. One of the other things that I really do want to highlight is that regional centers are committed to the privacy of each individual. So we are here to ensure that we're providing the services that you and your loved one need, and that we are keeping individuals' records private and within our system, and that that information that regional centers have is used to direct services, and that's it. That's what we're using that information for. It is also used for federal billing purposes for those people who are enrolled in Medicaid, but that is really the function, to collect information, to allow us to provide services, and to build the federal government to keep services flowing. The last thing I want to say very quickly is that I want to leave you all with a reminder of the incredible strength of the political advocacy of this community. The Lannerman Act would not exist if it weren't for the political advocacy of this community. We've seen challenges to funding for critical services for people with disabilities, both at the state and federal level before. And the key factor in all of the successes that we've seen in keeping services funded and expanding them during good times is the advocacy of this community. Because there are people who do this work professionally, who share the perspectives of the importance of this in Sacramento and in Washington, D.C. But at the end of the day, what moves legislative members, what moves congressional members, is the personal experiences and stories of the people who are most directly impacted and their families. So I would just encourage you to pay attention to what comes next. We don't know. We don't have a crystal ball, but we know that we are going to advance and we are going to see the greatest outcomes for our communities by focusing on ensuring that the stories of people who are most directly impacted are front and center. And we know that any proposals that come forward at the state or federal level are going to need to ensure that that both parties come to the table. If we think about the proposed cuts to Medicaid back in 2017, it was Republican votes that were needed as well to stop some of the proposed Medicaid changes. So I would just encourage everyone to be prepared to roll up your sleeves like we're prepared every year, and really be prepared to be engaged and to not discount the role of individuals with disabilities and their families in shaping policy at the state and federal level going forward. Thanks for the opportunity to be here.
Thank you so much, Amy. And I appreciate all of our speakers. And while our session is going to end at 1:30, we are able to stay on a bit longer if we have a lot of questions. So if we could get our panel up to ask questions, which are the speakers who are able to stay, I'd appreciate it. So we are giving folks a chance to ask questions. We are prioritizing self-advocates, by the way, to ask questions, as we always do. But if you would like to ask a question, you can. We've been recording some of them from the chat, but if you would like to ask a question verbally, you can do so by using the raise hand feature. And I will be calling on you as you ask questions, as you raise your hand. But notice that the order may not be in exactly the order that you raised your hand, since we have priorities of self-advocate. So speaking of self-advocate, let's start with Stephen Hinkle. Stephen, if you could just keep your question or comment to about a minute or so, I would appreciate that. Thanks, Stephen. Oh, sorry, I have to help you unmute. Go ahead.
Hello, this is Stephen Hinkle. Is there a way to educate people that in Congress and whatever, that disability is more than a financial cost, and not see this community as a liability to the things, but instead, if they're working even though to reduce numbers, to maybe adopt some policies that would maybe increase the outcomes in what they're doing. Like, for example, if they get people out of poverty, I'll just use that as an example, rather than keep people with disabilities in poverty as a policy, that would increase the tax revenue and maybe see our contributions to society as a more of an asset, even if it involves spending a little bit of money to get us there. Is there any way to change that conversation with people in Congress on both parties?
Thank you, Stephen. That's a great question. Does anybody want to try to take that? Alison, Zoe, Ben, Kim?
Judy, I'm happy to start. Stephen, thank you for that really great comment. And I think how we talk about what these programs do and what the lives of disabled people are when they get access to benefits is really, really important. And again, when we're talking about Medicaid, Medi-Cal, and people being able to access home and community-based services, sometimes those are services that help people be able to work, become taxpayers. We really need to think about talking about that disabled people as how we contribute to society and how Medicaid helps people do that. So I think really talking about that narrative, depending on who the member is, sometimes we use this word called return on investment, which means by putting money into Medicaid and into Medicaid programs, you're actually saving money in other types of programs. And so I think that's something that really working with people like Kim and others in California, I know you have really, really great information there, but the story that the community tells about the value of these services is really important. So thank you for raising that.
Thank you so much, Allison. Okay, now we're going to go to Lisa.
Can I add one thing? I just
Oh,
want to
yeah, please go ahead,
underscore.
Kim.
I think the question is so important because I don't think we think we're losing on policy. We're losing on communication. And I don't think we're going to win in 1 year or 2 year and 4 years. I think we have a decades long, if you heard this phrase, narrative problem. And we need to do some deep thinking about our words, our stories, our pictures. I don't even know if most people today would say autism is a disability, and yet it's the fastest growing. I'm working in an office where I bet most people don't know what the word developmental disability means. I'll just say it. So we're doing a lot of talking to ourselves, and we're not connecting with the fact that so many Americans have disabilities in themselves and their lives and their community. So I do think we need to be a little bit humble about what we know and what we don't know, and try to do some more listening and learning about how we can connect. I don't think they're opposed to support. I think maybe we're just talking past each other. I'm not sure, but I have a lot of questions about that. So I appreciate that first question.
Thank you so much, Kim. All right, let's go to Lisa Cooley. There you go.
Yeah. What is being done to protect Medicaid funded programs and other safety net programs in the new administration in California?
Thank you, Lisa. Kim, do you want to start and then we'll move to others?
Sure. I mean, I think the first step you saw this week in the special session that we will be ready to litigate, as we in 20 other states did this week in the Supreme Court. I mean, that is part of what we'll do, is litigate. I think the second thing is to look to our history. Many of you here may know that in the 70s, Congress said Medicaid can't pay for abortion, and California has paid for it ever since through Medicaid. So there are some gap filling that the state budget can do, but I don't want to be too optimistic. Medicaid is now about, gosh, I'm sure I'll say it wrong, probably 40% of our state budget. If the feds go away, it becomes all of our state budget. So it's a big fight to fight, and we'll do it, but we have a good history and present readiness to do that.
Great, thank you. Are there others who want to comment on that, or should we move to the next question?
Judy, I can jump in just on the federal level and say that calls like this are so important. I mean, just today I've been part of numerous coalition meetings of aging and disability and labor organizations. I think the fact that people are talking now before there is a proposal on the table, but while we're just starting to hear about it, is really important. So to your question of what is being done and what needs to be done. This type of talking about why Medicaid, why Medi-Cal is so important, what it means to people, really doing that education, especially for new members of Congress, is going to be really, really important. And I think the fact that people are activating and doing this now is really, really important. And I want to thank everyone in advance for their work on that.
Thank you, Alison. Mariana Guerrero, I'm going to let you unmute.
I wanted to start by saying thank you for this webinar. It has definitely been a lot of good information. I'm going to start by saying that I am a sibling of a 39-year-old individual with cerebral palsy. So all this information as a sister is very crucial for me to understand, especially because I'm also dealing with 2 adult parents who are in transition to old age. So for me, this is very important. However, I know that maybe the language for a lot of our Latino community who are here, it's going to be a little hard for them maybe to understand a lot of this information. So I wish that we were, again, continue to have these meetings so that we are on top of things that maybe we were not clear with, that maybe we can come back to these webinars and ask these questions. Because, for example, some of the families that I currently work for too are dealing with a lot of the immigration. They are scared. They don't want to contact no one. They're very limited to their conversations. And I wanted to also bring another topic to this conversation. The self-determination program, which is the key to success. It's been hard with the master plan. And I feel that we really need a lot of the support from a lot of the people here, Kim, Amy, the speakers, the governor. We really need the support because we're losing families because they really don't understand the system. So I'm here just to say thank you. However, we do need a lot of support, especially from everybody who spoke today, which, by the way, I'm extremely impressed. And again, Judy, thank you again for this presentation. Thank you.
Thanks so much, Mariana. Ben, I don't know if you want to comment on anything that Mariana said, you know, that we're representing a lot of families who are really scared and they're just not accessing services because of that.
You know, just one thing I wanted that came to mind as you were sharing was just the importance of language access. And so, you know, in any of our spaces, as we develop resources and develop messaging to keep our community safe or informed, it's just important. That's an issue we see persistent in our communities, is just that information not being in their language or even made to be more adapted to the language that they use in their day-to-day life, or in languages beyond English and Spanish as well, reflecting the diversity of our communities in our state or in the country. Yeah.
Thank you so much. Okay, let's move on to Roxana Guzman. Go ahead.
Hi. Thank you again so much for this meeting, and thank you to all the speakers. I just wanted to circle back to immigration. I know a lot of people with disabilities rely on their families for that natural support, and many of those people are, have mixed status families. And going back to, the fear of not knowing what's going to happen, should we, start hearing stories or just, being out in the community, if we start seeing those deportations happening and how people will be affected, for the speakers, what do you suggest us as a community do to support those people that are going to lose family members and that vital support?
Go ahead, Ben.
Yeah, great question. I shared one of the resources in the chat. It's a toolkit on how to rapidly respond when you interact with ICE. And they have a rapid response number, a toolkit for ICE is at your door, or if you're arrested by ICE. So the first thing I would say is just we need to equip our community members with that information now, so that if that happens, worst comes to worst, we're able to dispatch community members to assess the situation, also observe, basically do what we can to prevent someone from being arrested. But you brought up another point about when these separations have always been happening even before Trump's first presidency, and so when people are separated, we do see a loss in resources, or just most importantly that person in their life, and that being very traumatic. And so in California, we're trying to do what we can to make sure that the safety net programs we have can include those families if they do lose a family member, by not discriminating on the basis of status. So at the beginning of this year, Medi-Cal was expanded to everyone regardless of their status, and including people with disabilities regardless of their status. And so it's just, yeah, with all the uncertainty, I think it's important that people have access to the support systems, in addition to those mutual aid networks that we will need to form. But not all of it will be solved with policy. I think a lot of it has to do with kind of just building those connections, and also supporting one another as well, and in your own immediate surroundings.
And if I could just add one, we are very concerned about not just the family support, but the paid workforce in California across many industries, but caregiving is one that we already have caregiver shortages, don't have to tell anybody here, but the fear, the moving, the deportations, being ready to, like you said, Ben, for impacts on that side as well.
Well, that's stressful. Ruby Saldana, go ahead.
Buenas tardes, Ruby Saldaña, ICC integradora.
Ruby, un momento. For those folks who came in late, please make sure you selected your language. Even English speakers need to select a language so you could hear the interpretation. Sorry about that, Ruby. Go ahead.
Sí, voy a hablar en español porque en español es mi idioma natal. Quiero hacer eco a lo que Mariana dijo, y la comunidad IDD, siendo el 42.5% de toda la comunidad IDD hispanos. Para nosotros, primero les quiero dar las gracias por estar aquí esta tarde, y segundo, les quiero también decir gracias por ser proactivos. Ahora, necesitamos ideas de cómo traer a nuestra comunidad junta, la comunidad hispana, la cual es la mayoría, ya que nosotros estamos siendo impactados de diferentes formas. Es no solamente ahora inmigración, es el hecho de tu etnia, es el hecho de tu lenguaje, y tienes diferentes ataques por todos lados. Lo que yo estoy viendo en mi comunidad en este momento es el miedo ahora aún de identificarte como hispano. Esto lo vamos a mirar enfrente, y tenemos que estar listos. Yo miro 300 y tantas gentes aquí, y nosotros, si hacemos un llamado a la comunidad hispana, yo sé que estaríamos el doble, pero sé que mucha gente tiene miedo de hablar, y sé que mucha gente hispana está aquí y tienen miedo de hablar. Necesitamos ser proactivos y que nos den ideas de cómo activar a nuestra comunidad, la cual tiene mucho poder, porque detrás de cada individual hay mucha familia atrás de ellos, y aún proveedores, activar a los proveedores también. Eso es todo lo que quería decir, y necesitamos una idea de cómo activar a toda la gente que está atrás de un solo individual. Gracias.
Thank you so much, Ruby. And I completely agree. This is, at least I can say from Disability Voices United, our first effort to try to get organized. And I think that we will be working with many of the folks who spoke here. We want to be very involved on the immigration issue with the California Immigrant Policy Center. We are actually a member of the Protecting Immigrant Families Coalition, and want to work across the aisle with all political parties to try to protect the services, supports, and healthcare and rights that we have. So we will. This is the first of many webinars that we will be having. Thank you. We have a few more questions. I have 4 more questions up here, and I'm probably only going to go with these 4. So please, others, do not raise your hand because we are going to need to end. So I'm now going to call on Valerio. Go ahead, Valerio.
Hi, good afternoon, everyone. Thank you, Judy. Thank you, DVU, for having this webinar. Thank you, all of the panelists and speakers for your time. Wow, I'm impressed with Ruby's numbers. I don't know where she found all of that information, but that's amazing. Anyhow, I agree with her on the community being scared. I mean, I am too. And the thing is that I have heard through the grapevine that some of the regional center personnel were asking individuals for their SSN. And now I know for a fact that at least 2 people have been asked to provide their social security number. And I don't understand where they get the power or the basically the right to ask for the social security numbers. Are they trying to figure who is here on a good status or not? Amy, I think it comes to ARCA in this case to educate the regional center personnel in conjunction with DDS, because I don't think that it's in their power to ask for such a piece of information. And if people is going to be scared by being asked for their social security number, then most likely people will not even approach the regional center to get the so much needed services for their loved ones. I think this is just not just, it should be illegal for the regional center to ask for them.
Thank you so much, Valerio. Amy, go ahead, and then maybe we'll have Pam respond as well.
So just quickly, we talked a lot today about Medicaid and billing the federal government for services provided by regional centers. Current law actually requires the regional center to ask for social security numbers as well as insurance information, so information about Medi-Cal numbers. And the reason that that's being requested is because we need that information to be able to bill the federal government for services. Now, the natural question is what happens to that information, or what happens if someone doesn't have a social security number or a Medi-Cal number? Because the federal government requires that you have both in order to bill for services. So what happens is that then the services provided by regional centers just aren't billed to the federal government. So it's not that a report goes up that says to the federal government, hey, here's the list of people that we don't have social security numbers for or Medi-Cal numbers for. It really is just to maximize federal reimbursements. And as I said, law requires that question be asked. One thing that I will note is that back in 2022, ARCA had a piece of legislation that was ultimately signed by the governor that no longer requires regional centers to also ask for parents' social security numbers, because I heard a lot of concern about mixed status families. And so regional centers are no longer asking for parents' social security numbers. The law used to require that as well. I saw a question in the chat related to this. Maybe they should just ask for Medi-Cal number, why social security number? And the reason is that you have to have both numbers match in order to build a federal government. So because that prevents there from being a typo in the Medi-Cal number that then kicks it back out. So the two pieces of information have to be matched. That's the reason the law is the way it is. But it is in no way is it an attempt to find out from our community through the regional centers who is documented and who is not. That's not the intent at all.
So I think that what we're committing to do is to work closely with ARCA to ensure that service coordinators and others are informed of why that information is at all being requested, and to get information out to families to not be scared about this, because that information is supposed to be kept quiet. And we also commit to working with the immigrant rights community to make sure that that information is not going to be released in any way to endanger the individual with the disability who might be undocumented or their family members. So thank you so much for that question. Okay, Carolyn Talalian, go ahead. Oh, you just muted yourself again? Try again.
Okay, there. So thank you. So I'm from the Central Valley, and most of you know that we have a large immigrant citizenship here, I'll call them, and a large families and workforce. And what happened two elections ago when things came up again with the same president, we work at a children's hospital, and we gave a lot of information out. And I think it'd be really good if DVU puts on the website some of this information that we're getting today, but is letting families know that they can get medical care. They do not have to be a citizen to get medical care here in California. And we took care of everyone who walked through the door into the children's hospital. Also, and maybe Ben can help with this, at the time we had a disability rights group come and talk to us social workers at the hospital to inform families that if ICE does come to the door and knocks on the door and says you have to come out, we order you out, we were told that we can tell families that they do not have to open the door, that they, unless there's like some kind of a subpoena or some kind of paperwork, they do not have to answer the door. And I think that's something that needs to be shared with families, if that's still true or if something else is true. And maybe Ben can help start that.
Yeah, thank you so much, Carolyn, for bringing that up. And that is a really valid concern. I was actually just on a call with an advocate who represents community clinics in Los Angeles, and they developed a toolkit to inform their clinics on what to do in this situation. And that's the same guidance that they've shared. So without a warrant or a court document, they're not allowed into the examination rooms if they ask, and don't need to ask their patients to comply as well. So I can try and find that and share that as well. It's a very specific audience, but you work in that space, so I'd be happy to share that to confirm it and see if it's up to date.
Audience, and I also think here, I mean, we wouldn't have our food in the country without the Central Valley and the people who work in it. But I think we need to have like media blitzes. I mean, we need to have this out in our newspapers, not just, buried here and there. So anyway, thank you very much.
Agreed. We need messengers at all levels. And unfortunately, I think we all rely on the information like our cousin or our family member has, but that might not be fully informed. So, we're trying to combat that as well. Thank you so much.
Thank you.
And I just want to I know Zoe, you need to run, but there's been a lot of questions in the chat around the Olmstead decision and whether that could potentially be overturned. And I'm wondering, Zoe, if you have any thoughts on that.
Yeah, sure. Thanks, Judy. So the Olmstead decision was a Supreme Court decision that said that if people with disabilities are segregated, are excluded, are in institutions when they could live in the community, want to live in the community with supports, that's a kind of disability discrimination. So Olmsted is this really landmark case that has led to a lot of ways that people with disabilities have had more ways to live in the world and live in their communities. I think there may be threats to it. I think I can imagine sort of both direct and indirect threats. It could be challenges. There was a Supreme Court case this year that changed how the court thinks about regulations that implement laws. And so that could be a sort of avenue that someone uses to challenge Olmsted. And I think it could be this, a sort of head-on challenge to Olmsted, or more indirect ways that people try to sort of chip away at it. So it is certainly something that we are thinking about and watching. I think it's possible it doesn't happen. Obviously, I very much hope it doesn't happen, that Olmsted by and large remains in place. But it is definitely, a hugely important case and principle, and something that we're watching very closely.
Thank you. And with that, I really want to thank all of our presenters today. Amy, Zoe, Ben, Kim, and our elected officials, and Deanna, and our elected officials, including Congressman Ruiz and board member Nick Melvoin. Thank you all. We have a recording of this. We will put it out on our YouTube channel, and we will email it out to our whole mailing list. Thank you all for joining us today, and we hope to see you soon and work together. Thank you, everybody.
Thank you all.